Hey everyone, I'm Connor and I'm going to take you through this week's patient update. First up, we have a release of Swainson's Hawk 8624. This hawk was admitted after being struck by a vehicle in Rigby, Idaho. It was treated for head and eye trauma due to the collision, but some routine blood work also showed a severe parasitic infection in its blood. This patient had millions, if not billions, of infected cells, and after receiving treatment for these injuries and infection, the hawk was returned back into the wild in time for it to migrate, likely to South America. Up next is Osprey 830. This patient unfortunately was found tangled and dangling from twine in its nest outside of Alpine, Wyoming. After admission x-rays, we determined that the bird suffered a dislocation of its hallux, a raptor's first and most important digit of its talons. We were able to reduce the luxation and return the toe to its correct alignment, but unfortunately it can be very difficult to re-strengthen ligaments in birds in order to maintain that proper orientation. We will have this patient in a splinted wrap for the next couple weeks, but we'll have to wait and see for the results. A quick PSA about osprey: they often will use and fill their nest with different filaments like baling twine, rope, fishing line, etc. So it's really important to keep those items out of their environment whenever possible. Next is Swainson's Hawk 822B. This hawk was admitted from Ammon, Idaho after it had been attacked by a dog. It suffered a fracture in its left ulna, but after a few weeks of medication and care, we're already seeing really great callus formation at the fracture site. We will still need to see a couple more weeks of callus strengthening before starting flight conditioning, but so far this patient is on a great track. Here we have red-tailed hawk 726. This hawk came in from right down the road in Wilson, Wyoming. On admission, we immediately noticed a beak malalignment, which occurred because of an older fracture in its lower mandible or jaw. The beak had continued to grow out of alignment and eventually created difficulty for the bird to open its mouth. We have now been doing weeks of Dremel work to correct the alignment, so to avoid this happening when the hawk is returned back to the wild. Slowly but surely, we are reshaping the beak to its more natural positioning. Finally, we have Northern Saw Owl 714. Currently one of our longest treated patients. This small owl came in from May, Idaho with a left femur fracture. After a very challenging surgery, we were able to stabilize the femur and allow it to heal. 2 weeks ago, we deemed the bone stable enough and removed the surgical pin. Since then, we have been doing extensive flight conditioning and live prey testing to make sure this owl will still be able to hunt and survive in the wild. That's all we've got for this week. Thank you all so much for watching. Remember, if you want to do your part in keeping wild birds wild, you can check out our website at tetonraptorcenter.org and make a donation. You can also click the link in the description below to donate directly. Thanks!